Let's look into our agenda. We have seen that health tech is becoming an increasingly important topic for our community in the last years, and there are so many new services and solutions popping up. And since health has always been a little bit of a sensitive and very private topic, we are going to look into that from the trust and transparency perspective today. That's why we gathered a great panel of experts that are joining this event. And today we are going to look how tech can improve the relationship between doctor and a patient, why transparency counts when things go wrong with your health, and the future of innovation trends shaping our access and trust in healthcare. So with no further ado, I would like to move to our very first talk today about building relationships with your future doctor by Katerina Yakimzev. And while we are giving a digital round of applause to Katerina, I would like to tell a couple of words about her and her work. So Katerina is the Austrian regional lead for Doctify, the UK-based healthcare review platform. She was working with several startups, including Uber, and then she decided to join Doctify as their very first employee in Europe. Since then, she has led all their way to scale and growth here in our continent. Katerina, warm welcome to you. The stage is yours, and we are super excited to hear your presentation today.
Thank you very much, Raza. I hope you can all hear me well. Yes, so Doctify is the leading global authenticated patient review platform. With trust and transparency being at the core of our mission, we aim to provide information to enable patients to make the best decision for them. Next slide. Thanks. So we were founded in 2015 by two orthopedic surgeons and friends, Dr. Stephanie Els and Dr. Shuman Sahar, who were both working in the NHS at that time. And the idea for Doctify actually appeared when Stephanie found herself in the position as a patient. She discovered a mole on her body and simply wanted to book an appointment for a mole check, and came to the conclusion that it should be much easier in this digitalized world to find the right doctor for your condition. Since then, please go back. Doctify works with more than 20,000 hospitals, clinics, healthcare specialists across the UK, UAE, Austria, and Germany. And we're not stopping here. Our vision is to become the trustworthy global healthcare review platform, which is purely built from the beginning on real, honest patient feedback. Because there is no place for fake reviews in healthcare. Next. So how do we help those doctors we work with? So first of all, we are a closed review platform. Every patient has been collected, every patient feedback has been collected in the practice or hospital. So that's kind of the first filter. Secondly, every collected review is being read and verified by our Doctify team members to make sure no inappropriate language has been used. Because of the practicality of Doctify's review solution, doctors are able to collect a much higher volume of patient reviews. This, coupled with search engine optimization, allows doctors to significantly boost their organic online presence. These reviews are simultaneously displayed on Doctify, your own website, and on Google Business Panel. Next slide. There you can see an example of a Doctify widget integrated into the website of a consultant with the latest reviews displayed. As another case study, you can find the volume and the rating and also the peer recommendations of the consultants who work with us. So this actually breaks it down what the power of independent patient reviews actually is. So collecting a high volume of real patient feedback stabilizes your online and offline reputations. Patients are able to find all relevant information on your Doctify profile, book an appointment with you, and be able to leave a constructive feedback due to your open-minded feedback culture. And on the operations side, doctors and practice managers gain important insights through their analytics dashboard, as interpreting your data is as important as collecting it. And how do we actually help patients with our solution? Most patients these days look online to find healthcare providers. 3 of 4 people have searched online to find out about a doctor or the medical care. So patients are able to read real patient experience and make a decision based on trustworthy, transparent information and exact keywords of the condition or procedure, and also finds a specialist nearby and easily book an appointment with them. So here are, for example, 2 of our patient reviews. What you can see are useful insights of the overall experience, the explanation of the consultant, and the bedside manner, but also the specific reason why this doctor has been consulted. And I'm not entirely sure if that parent would have left that review on Google with the specific keyword attached to his or her Google account. So Doctify on the other side is anonymous. No account is needed for you to log into, and it provides you with insightful information. Next to it, you can also see the experience of the whole clinic, how patients, what the reason for their visit was. Basically, here you can see, for example, the dental checkup or crowns have been basically the reason why patients went to that praxis. So thank you very much for listening and the chance to present Doctify to you. And I'm happy to be here.
Katerina, thank you so much for the presentation. I know that we will have some questions for you coming in today by our audience who is here with us live, and we will do our best to cover them in the joint panel session and the Q&A afterwards. So now, everyone, let's go with our second speaker today, my group, a country manager at Insurella. We'll talk about how automation can empower individuals navigate personal injury claims. A warm digital welcome to Mai, and let me share a couple of words about you before you begin. So everyone, Insurella is a digital platform for healthcare insurance injury claims, and Mai is heading its country operations management. She had an amazing academic career in research and public administration, but then she decided that her true love is theorize in real time about what people need, why do they need that, and how companies can meet that need. Currently, she's a part of the Danish team driving their mission. So Mai, the stage is yours, and we are super excited to have you here today.
Thank you, Rasha, for those kind words, and thank you for hosting this conversation. Also, thank you, Katarina, for a really inspiring talk about what you guys do at Doctify. So, I'm here to talk about Insurella, what we do, and what our mission is, and also to give you a little bit of insight as to why we are here today for this conversation about transparency and trust. So Insurella is really all about fair compensation. For the time being, we are working with personal injury claims, and personal injury claims, they stretch quite far. Personal injury claims is if your doctor does something wrong, so there's a malpractice situation, or if you have a traffic accident, or if you injure yourself at work or in your home, whatever, whenever there is a bodily injury. And that is where Insurella started. And the reason we are here is actually because our founder, Markus Janbach, who's also our CEO, he had a rough rougher teenage life. He was a rugby player. He also had a mother who was a claims handler, an insurance claims handler. So he got a lot of compensation every time he injured himself. And when you play rugby, that is a lot. So he kind of took for granted, you know, you injure yourself, you get money. But he found out that that that's not the case for everybody. In fact, most people don't claim their compensation money. And if you look at the global market, there's about 100 billion euros out there waiting to be claimed. Now, what does that tell you? First of all, it suggests that there is a problem, because that means that it's the insurance companies sitting on all of these monies, which should be in the pockets of the consumers. This points to the fact that it is complicated, non-intuitive to file a personal injury claim. And if you look at a little bit more detail about what's going on there, when you have to file a claim, it's actually a legal procedure. There's a lot of rules or regulation that determines how much can you get, how are you covered, where are you covered, and how do you go about claiming that money. Now, this is not something that is being discussed a lot when you draw up an insurance. You file your insurance, you buy an insurance, and you're like, okay, so if something happens, you're good to go. But that's not really what we see. So people find it time-consuming, difficult to understand, not transparent, and also, could you go back? Thank you. A big one is understanding your rights. So in what situation am I actually entitled to money and how much? And I want to go into a little bit more detail about that one. Because what we see is that it actually differs a lot between markets. What does your rights look like and what do you have to do? And so if we take Denmark as the example, the procedure for the insurance companies will be, you know, there is a claim, and it is up to the insurance companies to evaluate that claim. Now, what the consumer doesn't know is that how they're going to look at it depends entirely on what kind of information they give them. And that can really decide whether or not they will get their claim through, or whether or not it will be rejected, or if it will be small or it will be bigger. And it's very difficult to actually figure out that you can do something about a rejection that often, because things move really fast and the insurance companies don't necessarily have all the information. So you miss out often on a lot of money. And there can also be a problem of simply just understanding, where do I have all my insurances? You can be insured through your employer, you can be insured privately, etc. So it's time-consuming, difficult to figure out. It's very difficult to understand your rights. And also, the lawyer industry, which could, you know, be the place to go to. You go to a lawyer if you need help with a case, but that is something that is not within reach for a lot of people, because it seems expensive. It seems like a big thing to go into, and you don't necessarily know if it's going to be worth it. And that's where Insurello comes into the picture. So our finest job is to empower consumers to receive the full compensation they are entitled to. For now, it's when injuries occur, but we have bigger plans than that. And how do we do this in a way that secures the customer, feels, you know, safe, data protected, is a smooth journey, and where you feel well taken care of through the entire process? We have, the way we do it, we have a secure and automated power of attorney. We have a process that helps us identify all the ways that you can be insured. It's very mobile friendly, and this is across all types of devices, and it's entirely digital. In Denmark, the insurance industry is already quite digital, but that is not the case for most countries. It's a very analog process. So there we're really speeding things up for the consumer, for the customer. So it's a digital process through and through for the customer. They will have an option to talk to us if they want to. We can do this in a way that is very smooth for the customer. Next slide. So this is a little look into what our platform looks like. At the moment, this is a brief overview of our portfolio, although it's not exhaustive. But so you have the different type of claims that we are working with, which is when you injure yourself. And then we have what's on the other side. We have a CRM system that we've built that is designed specifically for us to have a very smooth handling time. It's easy for the customer to use the customer-facing side. We focus a lot on customer communication, and we obviously protect your data. I think you can go on to the next slide. So what happens here is briefly, you make a claim. This is free. We will review the claim, and we will make sure that we cover all the ways that you could be covered. And then we will take the fight to the insurance companies as well. It's always free if we don't. So that also makes it safer, whereas with much of lawyer services has upfront fees. We never have an upfront fee. Yeah, next slide. And a little bit back to some statistics here. So today we want to talk about trust and transparency. Knowing that there are so many claims out there that are not being filed, or where people don't get the compensation they deserve, that really suggests a problem. In an industry that is very analog and is, relying on a lot of technicality, a lot of legal language, that in itself is a transparency issue, because it's difficult to get the information in an easy and understandable way. So that is our finest job, to actually make it accessible. The other thing is, when you look at the problem from a socioeconomic perspective, it is really people with lower education, or people who are migrants coming into the country, not understanding the language. They are the people who have the hardest time understanding this. So providing a cheap option for actually getting help on something that otherwise can seem out of reach, even though you're entitled to it, that is something that we take very seriously and see as part of our mission to change this. And even if you do understand insurances, this will take less time. So that's another upside. A third thing about this is that if you are ill, if you say that you have been through a really, really terrible accident, perhaps you've even lost someone, these things can get quite traumatizing. When you look at personal injuries, it can also be post-traumatic stress. Do you have the bandwidth to handle something so complicated, even if you do somewhat understand? No. So it's also a way to make sure that it doesn't really matter what kind of condition you're in, you have an easy, accessible, cheap option for getting the help that you need. All right. The last slide is really just about where we are right now, and I think that we can skip that because I can just summarize it quickly. This is a map of where we are. So like I said, we're working on personal injuries. Right now, we've just launched in France and Denmark. Insurello started in Sweden. I don't think I mentioned that. So 4 or 5 years ago, Insurello was born in Sweden, and now we're live in 2 countries and going on 3, then going on 4, and we will continue, and we're building verticals. So we're very excited for the future. Thank you.
Mai, thank you very much. We will definitely circle back to some of the points that you have touched in your presentation, especially in how you're using technology and what's your roadmap for continuous innovation, etc. And now, guys, I would like us all to zoom out a little bit and look into a broader perspective of health and health tech and all the innovation that is happening in this sector. That's why today we invited Valentin, a co-founder of Health Tech Hub Copenhagen, to join us for this talk and share a little bit about the Health Tech Copenhagen, about their mission, and his perspective on the future of health, a little bit about the trends, and really like a broad overview on what's happening. And before Valentin is getting ready, I also want to mention that he has tons of experience in health tech. He's actually a top-notch management consultant who helped health and tech clients on 4 different continents. and he's also a former head of innovation at Momentum Mental Healthcare. So Valentin, we are super excited to have you with us, and please share your vision. What's happening?
Thank you, Rasa, and thank you everyone for inviting me for the easiest task of the evening, and that is to talk about futures. And why is the easiest task? Because that's something that everyone is pretty terrible at predicting. So the bar is quite low. Now, instead of talking about possible scenarios, which is always fun, I'll use the next few minutes to talk about two topics that are very current and that might have a tremendous impact on health quality. The first topic is the role of communities. Now, communities historically have always played a tremendous role in our lives and in our health. However, they've been also tremendously underutilized by the health systems. That is until a few years ago, when slowly their role in health equality has started to become more and more apparent. And this is only seen to be increasing in the near and far future. We look at companies like, or you can call them initiatives like CityBlock in the US, Buurtzorg in the Netherlands, which is translated as neighborhood care, which is a network of carers that includes nurses as well, that is completely self-managing and self-managed, that has had great results. We look at Philips's so-called community life centers in sub-Saharan Africa and in Southeast Asia that have tried to bring together the health part, link it to technology, and enhance together the role of the communities in parts that have previously been inaccessible. Now, this realization is becoming more and more apparent, and in the future, we expect to see more initiatives taking advantage, and I say this in the most positive way, in the taking advantage of this huge lever that is called community. And how is that linked to trust and equality? Well, first, communities are by definition based on trust. That is also because they are somewhat smaller and easier to control, and communities keep themselves and others accountable. Second, when it comes to equality, communities speak the language of their members, so they can break through some of the most tangible limitations that enhance inequality, such as health literacy. The second point that I want to say a few words about is one that has been very popular during Corona and afterwards as well, as we have seen the value of health tech in the world. The investments and the investors have also started jumping on this. And we've seen a huge increase in investments and much higher appetite for risk from investors than we've seen before. Now, how does that affect trust and equality? Well, one point of view is that large investment rounds that we have seen lately, and that at least some have been very happy about, will not help these parts one bit. And that is that when you get, let's say, 1.6 billion US dollars in valuation on a $4 million revenue, there will come a time when there will be a lot of pressure on profits. There will come a time when investors will want to see some results back. And that, historically, at least, has translated in not necessarily the best outcomes for health equality. It has translated in some pressure on costs and sometimes in somewhat bad behaviors when it comes to data usage. We've seen an EHR system fined about a year ago in the US. One of the record fine over $100 million for getting kickbacks from pharmaceutical companies on drugs that they were supposed to objectively recommend to the doctor that they were working with. We've seen Kinsa, the thermometer makers, selling temperature data so that you can get advertisement for sniffles, medication, and tissues when you're sick. Now, that's the bad news. And that's one perspective. The good news is that we also expect and increasingly notice that there is a rise of a new category of investors that are well-intentioned, more concerned about giving back, and a lot more patience on their returns. And a lot of these new investors are former entrepreneurs and former founders. And my hope is that many of you in the audience today, after you've capitalized on the success, which I'm sure it's going to come soon if it's not there yet, you'll also become this type of investors, because we can talk a lot about many possible future scenarios for health, but at the same time, we can also work on shaping the future that we want to see. That's it. As far as my introduction, I haven't spoken about what we do at the Health Tech Hub Copenhagen, because there's too much to speak about that, and that's the least interesting part, I think, for the evening. Look forward to the questions and joining the panel with the distinguished colleagues that we've heard before.
Valentin, thank you so much. But before I actually invite everyone to join on this virtual panel, I still want you to talk at least like just a little bit about the Health Tech Hub, and perhaps like you were focusing like also on the investors' view on that, etc. So like, what are the innovations that you are hosting there that excite you and you think are going to definitely shape the future of health, especially from the point of digitalization, trust, and transparency? Just a quick introduction, because there are many curious eyes and ears here.
All right. Yeah. So just in one short sentence, the purpose for the Health Tech Hub Copenhagen is to accelerate adoption. This is something that I've experienced in the clinics as well. There are a lot of barriers when it comes to that. And there are many solutions, and there is technology that is available that are not the barriers for adoption. So we're helping these companies reach the people that they're meant to serve. We're highly selective, so we believe we work with some of the best companies, at least in Denmark. All of them have products on the market, and all of them many of them are in multiple markets. Now, I'd like to point out two types, or maybe three types of companies. One is a company, and the reason I'm pointing it out is because it's linked to Doctify as well, and that has to do with the democratization of feedback, so to speak. The company is called Rockstars, and they have done two things. One, that they are trying to be the so-called Trustpilot. Trustpilot is very popular in this part of the world. The Trustpilot of medication, and that means that many of their users are able to review the medication in a way that creates a very different type of real-world data than the pharmaceutical companies are being used to. The app itself is also an adherence solution. That's why people use it, and then they have the chance to review it. Another one is the solution is called Erasmus, and why they are one of also my favorite companies is they are working with a in a field that is normally has been somewhat left aside, and that is autism. The founder itself has a son who is autistic, and the founder is a serial entrepreneur. And what they do is extend the two things. One is create access to the best-in-class type of education and management of autism, and educate the parents and giving them the tools to be able to do the therapies and to manage the life of their children the way most of them want to. And second, as the kids grow up, we'll give a set of tools for them to manage and understand, self-manage and understand better some of the paths that they and some of the barriers that they're seeing through life. So access, solutions that provide access to care are very close to my heart. Solutions that work on prevention are very, very important, because we can build a lot of solutions that cure and build a lot of solutions around the current system, but we are playing a catch-up game right now. We are not going to be able to build enough to be able to keep the pace of what we need in terms of health.
And Valentin, thank you very much for sharing this. It actually sounds like we might need to organize a separate session only to talk about everything that is happening at the Health Tech Hub. And now actually, I see that we have some questions and comments coming in from the participants. We also have a couple of points that we need to circle back in our group discussion. So I would actually love to invite the other speakers, Katerina and Mike, to rejoin us. Good to see everyone. And for this panel discussion, I would like to first perhaps circle back to Katerina, who was our very first speaker today. And Katerina, like, we're living in the midst of the shared economy, and bringing reviews to healthcare seems like a massive painkiller for many of us who are making different decisions when it comes to the sensitive matter like our health. Can you tell us a little bit, like, what did you learn on this journey in terms of what customers are looking for in those reviews? Like, what are the most important criteria? And how doctors are dealing with the more critical reviews? How are you moderating those situations?
Really, really good questions. What we see, and it's not just relevant for one market. That's why we have the approach to be the global healthcare review platform. The patients are impatient. If they have acne, they just want the best specialist for their condition, for acne. They don't care if the doctor has been reviewed a lot on mole removals, for example. So you need to give these exact information very quickly. What we see with our platforms, we don't distinguish the complexity in healthcare, what the waiting time plays into the experience, what the friendliness of the receptionist, that's the overall experience. It's really, there are a lot of factors why a patient sees a consultant. So that's why we ask in our survey for the reason of their visit. And collect a lot of information from real patients about that. And doctors are, as I explained, we have a verification process. So we read every single review to make sure it's been a constructive feedback, because we don't have the approach to collect swear words and really vulgar language. And the doctor can reply to these reviews. And that's also very, very important for future patients. They see how the doctor is responding to negative constructive feedback. So that is also a very important feature we have in our product, that doctors can leave a statement to a negative feedback. For the moment, we collect the consensus, like the patients who are coming there who would never say anything virtually. They always come back, and the doctor, just yesterday was, I pitched to a doctor in the evening who just came back from the surgery, and he said, I'm seeing thousands of patients and I have an expertise, but I only have 10 reviews on Google. So he was a little bit ashamed of that. So I think we have a great solution for these great information which are happening in the praxis, in the hospital, and that's where we need to collect the reviews and the information.
Yeah, and then Katerina, maybe like, how do you incentivize people to leave their reviews?
It's really easy. I think just because we have the tablet in the praxis, we have a QR code which patients can scan in the waiting room. They receive an email link which they can also use for the survey. It's very intrinsic, I would say. And the consultants who see really, who are really keen to know how the patients feel, they just ask after the treatment, hey, do you have a minute to just give me an anonymous constructive feedback? And that's it's all these factors together, I would say, how we incentivize them, because they know it helps future patients to make a good decision. With that slogan, it helps them to leave a review.
Yeah, that's super interesting, Katerina. Thanks for sharing. And I would like to continue with the second question when it comes to like customer, because somehow we are living a golden customer age. And perhaps like for you, Mai, and what you are building, like I'm perhaps very curious to understand like what customer barriers are there to participate in personal injury claims? Like, is there any knowledge gap or perception? How are you educating customers like about your product, about being proactive, like simply doing that?
Thank you. That's a super good question. If I might start with how we get in contact with the customers. We use performance marketing as our way to approach customers. That means social media is our predominant way of reaching out to customers. And there we have customer testimonial as the base of how we market ourselves. So we let our customers tell their stories of what was their problem, how did they get help from us, and why should they go with Insurello. And in terms of educating, because of course what we also want to do is to actually work on closing that gap between, you know, understanding your insurances, your rights, what to do in a case. So we have built what we call the insurance school. So on all of our platforms, you can go online and you can actually find articles about what are your what's the things to look out for, what do you do about, you know, what do you need to think about when you talk to your doctor? What kind of treatments will help you to get the compensation you get? Because sometimes, you know, people, they don't always want to seek out a doctor. But when it comes to getting compensation, well, that's the way that you can prove that you were injured and that you have issues. So we also try to tell people to be proactive about it. Don't hold yourself back. Just go see that doctor. So we try to educate as much as we can.
Yeah, and that sounds amazing. And perhaps like education is generally like one of the biggest working areas for all the startups and all the innovators building something new within health. Because
absolutely. And that's what digitalization can do as well. It's accessibility, right?
Exactly. Yeah, that's brilliant. And I know that here, like among our online viewers and the audience, we also have some corporate professionals and leaders that tuned in today. So I want to also like check this corporate angle. And perhaps like Valentin, I would like your perspective is like, we have seen that large insurance companies are quickly moving with their interest in anything healthcare innovation. So how can insurance sector improve, especially when it comes to like transparency, digitalization? What innovations from the startup community can help this?
Now, it's a very good question, and thanks for that. I wouldn't, a small thing, I wouldn't say that they are quickly moving into this area, but that they are moving. Now, I think that one of the main shifts that is still work in progress is that of very deep quantification of results ahead of trying out solutions. I think the approach, a good approach, is to look, as we look at vaccines and as we look at medications, is to weigh the benefits versus the side effects. Basically, using that solution, what is the worst case scenario, or piloting a solution, what is the worst case scenario that can happen. In the case of digital solutions, many times the worst case scenario is not too bad. And for that reason, I would definitely like to encourage more of the insurance companies to minimize a bit or maximize their risk appetite, not when it comes to our pensions and other things, but to trying out, giving the new solutions a chance, and co-create that 10-20% that is required to make them usable in their own systems and their own context. One of the questions that why I'm saying this is because one of the questions that we got when I was working at the clinics some time ago in the Netherlands was whenever we were speaking about anything when it comes to prevention, which we all know is useful, we all know makes a huge difference. But one of the questions was, okay, we implement this prevention solution. How much will it save in the next 5 years? And that is not a question that you can answer because you cannot quantify something that you stopped from happening. So we need a bit of a shift in the mindset. And I know a lot of people at the insurance companies have a good mindset. So I encourage a bit more boldness in bringing this into their own organizations and challenging the traditional way of looking at this part.
Yeah. And Valentin, like you also mentioned a couple of times, like digitalization, I think that like still that's a big thing on the company's agenda, looking into their current business, innovation like TBD. And I also just like remembered that when I looked into your background, you worked with communities with low digital literacy. Digital health management is becoming like quite a mainstream. Like, can you elaborate a bit more, if I'm not mistaken, like who are the winning and the losing parties here in this change? And like, how can we bring more equality?
So without going too much into detail, because that was also during the time the consulting time with working with some of the clients. I think a company. I gave a couple of examples a bit earlier, and I'm only going to mention two now: CityBlock in the US and Philips with their community life centers in parts of the world that really lack accessibility and health literacy. I don't see right now, so to speak, losers when it comes to this. I just see a huge untapped need, a huge amount of people that could benefit from health literacy that are not reached by any solutions, and would definitely like to see a lot more of that. As I said, the role of communities, I think, is crucial when it comes to this, because suddenly there is no company, regardless of how large it is, that is going to be able to take on this task by itself. You need ambassadors. You need people that are able to preach and be next to the people that need it on an everyday basis. Not sure if that answers the question.
Yeah, it is also a very broad question, and perhaps there is no like right or wrong answer to that, but like we really appreciate you sharing your thoughts and experience on this. And guys, I see that like the window with comments and questions from the audience is blinking and it's on fire, and we have very little time left, so I definitely want to cover some of those questions. So one of them is actually coming from Matea, and it's addressed towards Insurella. Mai, so that's for you. Does Insurella have a team of legal experts? How do you analyze, and here I lost the question, how do you analyze all the cases? How do you handle that internally?
Okay, so yes, we do have a team of legal experts. The way it started in Sweden, it was actually, we built that knowledge internally. It was a bit simpler, but what we've identified with going abroad, with expanding, is that it's absolutely crucial to have the legal expertise, both the legal and also the specific insurance technical aspect, even knowing how do the insurance companies work with the cases, because when you understand how they work with a case, you can kind of backtrack and see, okay, so this is the point where they will reject. What can we do to make sure that that doesn't happen? How can we prevent that rejection or turn it around if it's already happened? So the expertise is absolutely crucial. And the way that we analyze the cases, with our platform, the way we've built it, we have an auto-fail system in place. This means that when people, they file a claim, the first thing they do is take a test. That means that we actually eliminate a lot of cases where we simply wouldn't be able to help because too much time has passed or they never actually saw a doctor, whatever it might be. So that way we can reduce average handling time. And what we then do is we make sure that people get a thorough explanation of why, because some of our customers, we find that even if we can't help them, they're grateful to get an explanation, because that's what they are sometimes just missing, understanding why. And the way that we analyze the cases, so we try to build this as much as we can through our tech. So having as many steps as possible be done using the software that we're building. And then the last steps, they rely heavily on the legal expertise and having designed good processes for analyzing this so that we reduce the average handling time. And just to give you an example of how far we've come, in Sweden, it is now possible sometimes for a customer to file a claim that is never seen by a person. And it goes all the way to compensation. We can't do this with all of it. That's not every time, but that's actually how far we've come.
And this is what we want to hear, because like that's inspiring, like to hear that those cases are happening.
And what it means, of course, is that we can then help even more people. So the quicker we can do it, the more we can, create better systems, the more people we can help.
Yes, helping them at scale.
Yeah, right. Exactly.
Thanks very much, Mai. And now I would like to move to the question from Jacqueline. And Jacqueline is asking, what should startups in the industry be thinking about when it comes to building digital products people trust? Oh, well, that's a very good question. And perhaps, guys, it's addressed to all of you. So who has any initial thoughts on this? What should startups in the industry, in the healthcare and health tech, should be thinking about or prioritizing? when it comes to building digital products that people trust? Like, what are the main elements? Like, how can we gain customers' trust in these days?
Well, should I maybe go for it? Yes, it's also a good questions. I believe the way, for example, Doctify does it with only real patient reviews is the first step how we ensure that patients in the future know everything what I see on Doctify has been collected. The last time I was in the praxis, I saw that the reviews have been verified, somebody's reading through it, and also that nobody from the outside can leave a review for a certain doctor without any information in it, with just 5-star, without any comments, with any information. So nobody's gaining anything out of a 5-star review, like a hotel review. So I think it is most difficult mission we have in our field, because you can't buy trust. It would be amazing. It would be amazing if I could go to a shop and buy trust from these consultants we pitch to, or the patients we want to engage more on our platform. But it builds up with time, and it goes really deep back into the relationship between a doctor and a patient, which you build up over time by being satisfied with your consultation, and you recommend. That's what every doctor tells me, the word of mouth, and I always agree 100%. I say, in your field you can't buy patients. A happy patient will recommend you to the family, to friends, and we just want to digitalize and to represent it the best possible way. And it takes time, but the organic growth way is the right way, in my opinion.
Yeah. I absolutely agree with you. And what I can add to that is what we've also seen is what just builds the most trust is to see the customers actually tell the story.
Yeah.
To see that people who've used the service are happy and they trust the product, and you can partner up with already existing, like we're good in the startup community to help each other, and in general, like if you can partner up with someone who's already further along on the trust journey and it makes sense, then that's also a way to go. But you will get nowhere without letting your customers talk for you, I think.
Yeah, and I think here the important thing is like also customers, like especially when it's health, it's a, again, sensitive, very individualistic.
Absolutely.
Matter. They also want to relate. So perhaps other customer stories and just like hearing that you're not alone in this, and someone else is experiencing the same thing. It's a powerful step towards that product or the adoption. What do you think about the personalization? Because again, with technology, we try to create impact at scale, which means generalizing and providing everyone with the same solution. But at the same time, healthcare is quite individualistic, right? What do you think about the whole perception of personalization as of use? Like, are there any specific ideas and points how technology and especially digital products can tap into that?
I can say a few words on this, and that is in order. I think it's a good bridge, because trust is a good foundation for personalization. In order to be able to personalize pretty much anything, the person that receives has to trust you with a certain level of information. It has to trust you with a certain level of data that will allow you to give that back to them. And for that to happen, I would say there are two dimensions. One is whenever you say that you have the patient's best interest at heart, mean it. That's extremely important. Don't make it a paper reality, make it a reality and live by it. And that will allow you also to respect your customer in terms of communicating things that are a bit more sensitive. And one of those is the use of data, right? Because everybody is worried about how their data is going to be used. But if you mean it, you can, most of the times you can make a case that, and this is what we discuss also with some of the authorities as well, that not using data that you know would be able to enhance the quality of care and health is less ethical than using that that data, because we tend to talk a lot about the ethics of data usage, but one of the things that is going to happen more and more is also discussions around the ethics of not using data that we have.
Yes. Yes. Yeah,
Valentin, if I might add to what you said about this linking to the trust thing, I completely agree. And something that we see that sort of hinges on this is that we had the assumption that here in the beginning, it's super important that we actually talk to our customers. So we designed, like for moving into new countries, we have a setup where we actually talk to the new customers we get in before we take over their cases. But we found out that as long as people have already signed up, they already trust that it's a good service. And they do that because we have testimonials from other people saying that, you know, this is the way to go. They wouldn't have signed up in the first place if they don't trust us. And actually, in this digital age, people really want things to be quick. So they want you to be reliable. They want to know that my case is in good hands. And if I have a problem, there will be someone solving it. But they don't necessarily care so much for you spending time like face to face, so to say, necessarily, because people also just really want things to be smooth, easy, low barrier, quick, and no worries. And that's what the digital way actually brings.
Yeah, thank you very much, Mai. And guys, now we have a big fish to fry because we have literally a few minutes left, and we have a question coming from Alexander, and I would definitely love to cover it here today. And Alexander is asking, how can we rebalance the profit motive in healthcare against outcomes? Many organizations are talking a lot on patient centricity, but how do we achieve it in practice? I told you it's a big one.
Yes. I'm not sure we will be able to find the answer in the next 2 minutes on this.
Yeah, but perhaps like maybe like a couple of highlight thoughts on this.
I can say a couple of words on this. There are many ways to look at this, and many levers that can be pulled. If I only have 1 minute, which I do, less probably 30 seconds, I would only say this: we need to be able as patients, because we are all patients at some point. We need to be able to have some level of control of our own data, and that to me is the stepping stone of any type of patient centricity, because that allows you to understand how the information that you use is being used, and give both permission, but be at ease and understand what is exactly that is out there, and how does that affect your outcomes.
What you're saying there is exactly what transparency is, right? That's what transparency gives.
Exactly.
Security.
Exactly. And guys, I know that we opened this Pandora box with Alexander's question because it's a big topic. So Valentin, thanks for being brave and putting, the starting point. I would just encourage Alexander to get in touch with you guys, perhaps for a meaningful digital coffee and discuss that in more detail. And our time is up. And I know that everyone is having busy evening agendas after their work day. So I just really want to thank you all, guys, Mai, Katerina, Valentin, for being here with us and speaking about it, and also for being the innovators driving the change, transparency, creating more trust, and digitalizing our health. Thank you very much, guys. And now, to wrap up our event, this is Tigers Explore, our global series of talks by and for Talent Garden community and all the digital enthusiasts. And of course, we are organizing these events on a regular basis, and we definitely appreciate your feedbacks, inputs, and suggestions when it comes to the future topics. So don't run away now. We would really appreciate your help in shaping upcoming sessions. So if you could take a few minutes and fill in the survey, our team would be extremely happy. Thank you very much, guys. Thanks again to all the speakers. Thank you to Talent Garden team, especially Sam, Chiara, and Alina. And we look forward to seeing you at the future editions of Tigers Explore.